absence of disease or infirmity. Hello there and welcome to Wellbeing, a program that keeps you updated on health issues and general well-being. My name is Emedion James, and on today's show we are going to talk about a serious but not so serious sickness, and that is hepatitis. But before I delve deep into the topic and also reveal my guests, I would like you to watch this specially prepared health report on hepatitis. Hepatitis is a liver disease caused by viral infections that affect millions of people worldwide. Despite its prevalence, hepatitis remains a silent epidemic with many cases going undiagnosed and untreated. The term hepatitis comes from the Greek word hepa, meaning liver, and tis, meaning inflammation. This refers to the characteristic liver inflammation caused by the virus. According to World Health Organization, an estimated 1.3 million people died from chronic viral hepatitis B and C in 2022, that is 3,000 deaths per day. An estimated 254 million people are living with hepatitis B and 50 million people are living with hepatitis C worldwide, and 6,000 people are newly infected with viral hepatitis each day. In particular, type B and C leads to chronic disease in hundreds of people who live together and are most common cause of liver cirrhosis, liver cancer, and viral hepatitis-related death. An estimated 354 million people worldwide live with hepatitis B or C, and for most, testing and treatment remain beyond reach. How did hepatitis even come about? There are 5 types of hepatitis. Hepatitis A, first identified in 1947 by Mark Callum and Brantley in ancient Greece and Rome. Hepatitis A primarily spreads through the injection of contaminated food or water. It is associated with poor sanitation and hygiene. Hepatitis B is a contagious viral liver disease. The virus is spread through contact with infected bloody fluids, especially blood, semen, and vaginal fluids. Hepatitis C, first identified in 1989 by Cho and colleagues in the 20th century in the United States and Japan. You can develop hepatitis C by coming into contact with the blood of a person with the virus. This can happen by sharing drug equipment, getting a tattoo, or piercing at a place with poor infection control, and several other ways. Hepatitis D, first identified in 1977 by Rick Zetto and colleagues. People can only get hepatitis D if they have hepatitis B. Hepatitis E, first identified in 1983 by Reed and colleagues, was found in the stool of someone infected with the virus. It spread when someone unknowingly injects the virus, even in microscopic amounts. In countries with poor sanitation, people most often get hepatitis E from drinking water contaminated by physics from people who are infected with the virus. The quick question now is, how many people are aware of these hepatitis? How many people have even done their screening? Let's find out from Dr. Ibok, a senior registrar with University of Uyo Teaching Hospital, about hepatitis, the symptoms, and the way forward. Join us now on Wellbeing as we explore this together. Welcome back. On today's show, we are very privileged to host one of the finest doctors in town, one with over 10 years of experience. There is something peculiar about well-being is that we invest not just time, but also we try as much as possible to bring experts who will come and give you more insight into today's topic. On today's show, we are privileged to host Dr. Samuel Ibok, a senior registrar in the Department of Medical Microbiology and University of Rio Teaching Hospital. So let's hit the ground running. What is hepatitis? And I'll also like you to talk about the causes of hepatitis, even though in our special report, all those things were said, but then most times, people always love to hear from their horse's mouth better.
My name is Dr. Samuel Ibok. I'm a senior registrar in the Department of Medical Microbiology and Parasitology in the University of Uyo Teaching Hospital. Hepatitis is an inflammation of the liver cells. So liver is one of the important engine room of the body. It helps in the body metabolisms, and when they are infected or being injured by any means, they got inflamed, and that is what is referred to as hepatitis. So hepatitis are of different types. They have different causes, the infectious causes and the non-infectious causes. The infectious causes can stem from bacteria causes, fungal causes, viruses causes, and even parasitic causes. While the non-infectious or hepatitis are the ones that are caused by excessive drinking of alcohol, may be caused by autoimmune disorders. It can also be caused by drug-induced injury to the liver. So these are what causes hepatitis.
I'm just curious, and I know you are too. When they say hepatitis A, B, C, D, what does it mean? And what do they all stand for?
Hepatitis A, hepatitis B, hepatitis C, D, and E. These are a sample of the infectious causes of hepatitis, and they are being caused by viruses. All these are viruses. We have hepatitis B virus, hepatitis A virus, hepatitis C virus, hepatitis D virus, and hepatitis E virus. So they are the common causes of hepatitis, and they have complications which can eventually lead to death if not treated early when they appear. Then for the hepatitis, we have the hepatitis A and hepatitis E. These are the ones that causes acute infections. The acute infection is the one that doesn't last for a long time, and these the hepatitis A and E are being transmitted through fecal-oral. When we say fecal-oral, that means these viruses are being secreted in the stools, in the feces. And when an individual feed or drink anything that is being contaminated by stool, they are at risk of contacting these types of hepatitis. And for the hepatitis B and C, these are the ones that can cause both the acute infection and the chronic infections. And they are the ones that can also have severe complications if they are not handled, unlike the hepatitis A and E, which can be self-limiting. Whether it's treated or not, the body can wall it off and then eliminate them. And we still have some that may all still come out with some symptoms, signs and symptoms. And they do not really have, for hepatitis A and E, they do not really have treatment. What we do for them is called treatment that will help the liver itself to recover from them, not actually the treatment that is being targeted at the viruses. And that is why he said that they are self-limiting. So if the liver is being cared for and given those supportive treatment, they can recover and then recover fully from these viruses, unlike the hepatitis B and C, which have treatment which are actually targeted at the viruses. And one thing about most of the virus or infection, they do not have cures. Like example, like the HIV, that will need to take drugs that keep them suppressed in the system. But with the recent innovation in medicine, hepatitis C, if is being diagnosed early and treatment commence in time, we can actually achieve cure. But for hepatitis B, what we can achieve is just the viral suppression, having the viruses being reduced in the system.
Thank you so much, Dr. Ibok. Now, hepatitis are all classified into different types. Now, hepatitis A and B is when you eat contaminated food. Hepatitis B and C is when you share sharp objects. Now, it is also found in the blood and fluid. Now, if you have sex with someone who has hepatitis B or C positive, you are going to be infected. Hepatitis D can only happen to someone who is infected with hepatitis B. So if you have hepatitis B, you are very prone to have hepatitis D. But the good news is that if you get vaccinated for hepatitis B, you can't have hepatitis D. This is really a lot because hepatitis B and C is gotten through contaminated food, and at some point in our lives, right, we've been exposed to certain things directly or indirectly, and that's to say that right now you should pay attention to what you're eating, because you never can tell where you're going to pick this virus from. Thank you so much, Dr. Ibok. Now over to the next question. Who is at risk of having this infection? And when we say care for the liver, for a layman, what does it mean?
The care of a liver is it start from what you eat, what you take in. So if you are taking things that are injurious to the body, most of the things that we take, whether they are toxin, whether the things that the body doesn't need, it is the liver that will have to manage it, clear them off. So if you keep taking things that are toxic to the body, for example, that I said one of the non-causes of hepatitis is excessive drinking of alcohol. So you keep overwhelming the liver with the alcohol. The liver, what it does when a man take alcohol, it break it down and put it in a way that the body can handle it and excrete it. So if you take more than what the body can manage, it now begin to hurt, injure the liver cells. And with that, you reduce the function of the liver. And when you reduce the function of the liver, there are a lot of body metabolic processes that will be hampered. So in taking care of our liver is eating right and drinking right. Then the hepatitis, like what you said, who are the people at risk? Okay, like I said, that hepatitis A and E are being caused by are being transmitted by fecal-oral. That means through the oral route, through the mouth, by eating what has been contaminated by the feces. So good sanitary condition can help prevent. So having a good sanitary condition and good hygiene in preparing your food, in treating your drinking water, can help prevent hepatitis A and E. But for the hepatitis B and C, which are being transmitted through percutaneous or tissues, that means you have to pierce the body for it to enter. So it can enter through blood transfusion. So anyone that is taking blood transfusion is at risk. That is why nowadays, before a blood is being transfused, it has to be thoroughly screened for all these diseases that can be transmitted through blood, so that you can now protect the person from getting infected. Then other people are the drug users, drug abusers, those that normally the drug users, the drug abusers, they use syringes, choke them, like they shade syringes. This one, have you finished? Give it to me. Collect and choke his own. This one, choke and choke and choke. So if there was someone that had hepatitis B or C among them, that means they will now transmit it among themselves. Also, the health workers are also at risk, because they are the ones that have this interaction. Most of the time we heard of needle prick. So needle prick, if it was a needle that was used to give injection to someone that has hepatitis B and then mistakenly now prick the health workers, it can now transmit the infection. So these are people who are at risk. Even the newborn, especially for hepatitis B, it can be transmitted from mother to babies, to newborn at childbirth. And these are things that I think people need to be aware of. And also, I think in later on I will talk about how to prevent all this. Yes, we have these people who are at risk. How can they prevent it? So we'll be able to talk about it later in this discussion.
Thank you so much, sir. There is something that he said that really struck a chord to me. He says that the care for the liver starts with what you eat. So right now you should be very intentional. And he also pointed out drinking excessive alcohol. I know most times people say alcohol, I take it when I'm depressed, it makes me feel good and all. Exactly. But then, have you thought of the long run? There is this scripture in the Bible that says, better is the end of the matter than the beginning thereof. I know it makes you feel good for the now. But what about 10 years from now? What about 5 years from now? And then you cannot be taking alcohol because you want to prove a point that you are a man, or because you are sitting close to people who dared you. Our livers are not the same. Your friend can take lots of alcohol and survive, but what about you? Anyways, let's move over to the next question. Dr. Ibok, how are these different types of hepatitis B transmitted, and what are the possible symptoms? Do they all have one symptom, or maybe hepatitis B has this, hepatitis C has this?
Okay, so the mode of transmission, like I said, fecal-oral, that is for A and E. Then we now have the one that can transmit through piercing the body. And like I did not mention multiple sex partners too, because hepatitis C can be transmitted through sexual intercourse. Hepatitis C virus is seen in almost all the body fluid, even in the saliva, in the sweat, in the semen, in the vaginal secretion. So if it can be transmitted through sex, even kissing. So, and the mode of transmission, like someone that is taking blood transfusion, people that are receiving dialysis, are undergoing dialysis, they are always sharing equipment, and also they are also candidate for frequent blood transfusion. These are people who are at risk, like I said before, the health workers. So these are the mode of transmission through sharing of sharp. It's not just comb may not in just so sharp. Like we advocate that like ladies, they can have their kits when they are going to fix their hair, so that you don't end up sharing with others. It's not only hepatitis, we also have HIV, which we are still grappling on how to contend with it. So we can have those kits. Go with your own. You want to fix your hair, this is my own kit. Like for men, you have your own shaving machine. You go with it. This is the one that you can do. Yes, I know that many barbers now have been oriented on how to clean their devices so that they don't transmit. So we see them do that, and these are ways that we can help prevent. And also, by way of prevention, about 2 of these viruses, hepatitis A and hepatitis B, have vaccine. So it can actually be prevented by just receiving the vaccination. So with this, you can be able to help yourself prevent the transmission of this infection.
Something that he said that I kind of screamed inside of me was when he talked about the hepatitis C can be transferred through kissing. So I mean, to think that the least thing like kissing someone, you could have hepatitis C, just got me very scared. So while he was talking, what came to my mind was, the next time you are around somebody and you want to kiss the person, please do me a favor, ask the person, have you gone for a hepatitis screening? Because you never can tell. And then, hepatitis is so funny. We have healthy carriers, so you never can tell that just by kissing somebody, just by sharing needle, a comb, pen, you could get this virus. And most times this virus, if it is not detected early, there is no cure. So that's to say that you have to be very, very mindful. And I'm also using this opportunity to encourage everybody to do screening, because one of the ways you can identify that you are hepatitis positive is by doing your screening. Now, the screening is very, very important. And just so you know, if you have noticed any of these symptoms, please see a doctor. Now, most times on health shows, I always emphasize, in as much as we give you information on this sickness, we also try as much as possible to encourage you to see a doctor. And seeing a doctor does not mean just because your mother is a nurse or your sister studied medicine and all. No, you have to see a doctor who is well trained on that topic. This is someone that will give you the correct and concise knowledge on what you need to know. Let's go over now to Dr. Ibok. I know you mentioned it earlier, but then I'd like you to talk about it again. How bad is alcohol to the liver, and is it possible for one person to have more than one type of hepatitis?
Okay, I think we should have this one straight from here. It's not drinking that will end up having hypertension. We have said we've qualified excessive drinking or excessive consumption of alcohol. So one person we have our body that manages substances differently. The other person may be soaking himself in alcohol, may not come down with. The other one may just be taking few bottles and maybe do it like a regular thing and then come down with. So, but what we emphasize here is just be moderate. If you can just reduce your alcohol consumption, better. If you can stop it, that will be fine. Because when you take alcohol, the body doesn't need alcohol. What it needs is just something that makes us feel is pleasurable to drink and all that, just make us feel better and all that. Some people take it when they are depressed or maybe facing one challenge or the other. And alcohol is something that you can get addicted to. And after many years of drinking, it may in turn damage your liver cells. So what the body does to alcohol when you take, because it doesn't need it, the liver is now left with the duty to detoxify the alcohol. Alcohol come in a toxic. You heard of sometimes that we have people that were drinking concentrated alcohol that got blind, some fell down and died at the spot. So that shows how much harm the body can get from just taking alcohol. So the liver will have to detoxify, break it down into the component that the body can manage and then excrete. So if you continue to be taking the liver cells keep decreasing, keep getting injured, it will come to a point that the liver will not be able to perform this function again, and then it will now be overwhelmed, and then you start having this inflammation of the liver that will end you in having alcohol or induced hepatitis. Okay, then the other part of the question is said, why is it broken into hepatitis A, B, C, and E? Yes, it's not broken. It's just the viruses that were identified. And the people that, most of these organisms that we call them, it was people that actually named them. Like in the creation, God told Adam to name organism. And the way anyone then gave a particular name, so was it. So that is the same thing. Most of these organisms were discovered by men, and they decided to name them hepatitis A virus, hepatitis B virus, hepatitis C, and so on. And the other question that you said, can one person have all of them or some of them at the same time? Is possible. It depends on the route of transmission, how the person has been exposed to. Like In my practice, I've seen someone that have hepatitis B and hepatitis C at the same time. We have also seen someone that have hepatitis B and hepatitis D. Normally, hepatitis D virus do not cause infection on its own. It normally causes a co-infection with hepatitis B. And if the person has been exposed to eating something that has been contaminated by stool that contain the hepatitis A, that means the person can have hepatitis A at the same time. So which one the person have depend on how the route or how the person was exposed. So that is it. And it's not always the case that it must always be all. The person, it can be one, or it can be in combination with another one, depending on the source of exposure.
Thank you so much, sir. Let's go over now to the next question. Now, Dr. Ibok, how can one know if they have this disease? Because the symptoms are quite similar.
Like I said, that most of the symptoms that I mentioned before now, about that any individual that have this infection can experience, they are not specific only to hepatitis. You can get it in some other disease conditions. So just experiencing this is not enough to say that you have. So we have screening tests, which I feel that those who have at risk should have like a routine, maybe yearly. You know that you are a drug users, all those people that abuses drugs with injection and all that. You are a multi-sex partner person or a sex worker. I think it's important that they take precautions. Not sharing of sharp, it will reduce. But how can I know whether all this while, since I've mentioned here that some of them are asymptomatic, how can I just screen myself? There are screening tests which you can do in the hospital. If you have any doubt, it's only in our climate that you really see people coming for health medical check. It's only when we are down with a disease, that is why we will come. But it's also good to have it as a routine. Maybe once in a while, you just come and say, I want to do some screening tests. Especially for those who have been exposed to one risk or the other that I've mentioned here. They can run a blood test that will help you, that will help the doctor to know that, okay, you have hepatitis. It can be reported as, okay, hepatitis B positive or hepatitis B negative or hepatitis A positive or hepatitis A negative. So those screening tests are there. And some of these screening tests can also be used as to diagnose. So the same way you screen, the essence of screen is to know that whether you have or not. So if it's positive, you now start follow the management, the treatment. So it's still the same screening test can be used for diagnosis.
Of course, if you've been watching Wellbeing for a while now, you could literally sing it with us. Go to the doctor, go for a regular checkup. It's something that we always say over and over again, especially if you have seen these symptoms. Just so you know, an estimated 254 million people in the world are living with hepatitis B. 50 million people are living with hepatitis C worldwide, and 6,000 people are newly infected with the viral hepatitis each day. That's like today, Monday, like this, 6,000 people are being infected. Now imagine if everyone that noticed this symptom, in fact, whether you notice it or not, imagine if everybody went for hepatitis screening. The world would be a safer place. I don't know how much the screening is, but it's better I screen myself and I'm sure that I'm okay than to assume I'm fine and I go around spreading this disease. Thank you so much, Dr. Ibok. But then I also have one question, which is the very question that is on everybody's mind. Is there any cure for hepatitis?
Behavioral changes is very, very important. And we know that if we make up our mind, there is possibility that we can go through those things. Some of the hepatitis can be cured. Some can be managed. Like I said, that hepatitis A and E, this one doesn't have treatment, but have supportive treatment. They are self-limiting. So if it's noticed in time, and if the person have symptoms and you have done a test and they said, oh, you've come down with hepatitis A infection, hepatitis E infection, they start giving you those treatment that will help the liver to recover and then clear off the infection. You are fine. But if nothing is done to stop the progression infection, it may continue and it may eventually damage the liver and eventually cause death. Then for hepatitis B and C, they are targeted treatment drugs for them. So when you are diagnosed of hepatitis C, there are drugs that you take, and you take it as going to prescribe. It will help suppress the viruses. That means we say that we have the person has have viral suppression. That means if they take your blood to do the test to look for the virus, they may not see it in your system. But it may not, that does not mean that the virus is actually out of your system. For some people, after stopping the drugs, the virus must still spill back into the blood. And then, but for hepatitis C, if the treatment is followed and is done, it can achieve cure. But for hepatitis B, you need to be on the treatment, because it is a treatment like HIV that they say that we have understand that they have come to accept that we don't have cure. Though we know there is some of advances that are being made. We are hoping that in future maybe there will be cure. So the same thing with hepatitis B. You take the drugs, it will help you live your normal life. You will not have those complications you would have had if it was left untreated, and you have suppressed. And when the virus is suppressed, your risk of transmission to another person is also reduced.
The essence of this interview is for awareness, so we won't have to end up, with any funny virus. But just in case you are down with hepatitis B, it's not the end of the world. If you follow your treatment properly, there is a way it can be handled. Dr. Bock said, well, to some, depending on when it was discovered in your body, it can be managed properly. So yes, you can still make it in life if you end up being, having hepatitis virus in your body. But regardless, please, let's go for the screening. I know one of the things that will stop people from, completing their treatment might be side effects. So, Dr. Bock, do you mind telling us about the side effects of, the treatment? Are there any side effects? And if there are, how can people go about it?
There is no medication that do not have side effects, but I'm sure that as this side effect comes, the doctor will be able to manage them. It's not all side effect that manifests in the course of treatment, but if there is any side effect, the doctor will be able to manage, and you'll be able to continue to progress with the treatment.
Of course, there are side effects to everything. I mean, there is every good to every bad thing in the world. But regardless, don't let these side effects stop you from completing the treatment. And the good news is that if you discover hepatitis on time and you follow the due treatment, it can be, taken out of the system. But even if you discovered it late, if you follow through the treatment prescribed to you by a doctor, you will be able to manage the situation properly. Still on this particular issue, Dr. Bock, before I proceed, I want to say a big thank you to you for all the wealth of information that you shared to us. But then somebody asks, how can they prevent hepatitis from happening to them? Because to be very honest too, you never can tell who has it. They are very healthy carriers. You never can tell if maybe your girlfriend, your husband, your wife, So how can someone prevent totally from having this disease?
The prevention is this one of the way of prevention, the awareness. So that people that were not aware how it's being transmitted are now aware. So when you know how things it can be transmitted, you can do something to stop the transmission. So number one is for being abstinent for those the sexual promiscuous of people, abstinent, or you use protection. It can help you prevent. Then for those that the health workers, you observe standard precaution. There is something we call standard precaution in the management of patient. So when you observe them, use of personal protective equipment, it will help you not to have those needle prick, and also you are careful how you cap your needle. Then another thing is also not sharing of sharp. If as much as possible you can procure yourself with your own kit, barbing kit, hair fixing kit, nail cutting kit, and all that. It can help reduce your risk of having the infection. Then another level of infection is on the vaccination. Hepatitis A have vaccination. Hepatitis B is included in the immunization routine for infants. So you take the vaccine, but for adults, the immunization, the vaccine will be potent for about 10 years. After 10 years, you need to take a booster for hepatitis B. So even when you have already taken the vaccine as a child, as a baby, that means after 10 years, there should be a booster. So you now take it again. The vaccine is given once for hepatitis B, once every month for 3 doses, and you are protected. So, and also, let me also bring something. I know people might have, can I marry someone if my spouse is positive? Can I marry the person? Yes, you can marry. It's unlike the HIV, because this one have, if it is hepatitis B that have vaccine, and then you people have gone for screening, and one of the partner is known to be hepatitis B positive, it's just for the person to go for proper medical examination, and if there is a meet the criteria for treatment, start the treatment, while the other partner can also go and take vaccine. And with the vaccine, you are protected. Even when you have sex with your spouse, the risks will not be there, because you have already developed an antibody. That vaccine will help you develop antibody that fight against you getting infection. Then also another level of prevention is on mother to child infection, if it is the woman that is hepatitis B positive. So for women who are hepatitis B positive, when once you are pregnant, you need to be given a specialized antenatal care. We have many from primary health center that will refer to us here, that we have to monitor and manage. So one thing that can be done, they will do a viral load for you. Try to know how much of the virus in the system. If the viral level is very high, will commence the mother with the treatment. Then for the child, when the child is being born, within the first 72 hours of the child on earth, after birth, the child need to receive an immunoglobulin for hepatitis B, and also receive hepatitis B vaccine. These two should be given to the child within the first 72 hours for a child who is born to hepatitis B positive mother, and this will protect the child from getting the infection from the mother. So with this one, the mother must continue the normal breastfeeding. You don't need to deny because he has been given the normal treatment and the vaccine that needed within the first 72 hours. So that child is protected. Then another angle of prevention is, if you are hepatitis B positive pregnant woman, you don't need to take that to deliver your child at home with the traditional bed attendants. You need to be delivered in the hospital by the healthcare worker, the midwives or the obstetricians. They have an idea on how they can prevent that mother to child transmission even at the point of delivery, because there is a special care that need to be done at the clamping of the cord. So if you clamp it at the wrong point, you can push the blood of the mother into the child. That will now, even when you now give this immunoglobulin B that we are talking about, it may not be effective. So it's important that for every a pregnant woman with who is hepatitis B positive to deliver at a health facility in the hospital. Okay, I think one of the ways is this program that your television station is doing is going to go a long way. You will have a wider reach that people will be aware. Then we also have many organizations also taking it medical outreach. I know in churches like my churches, almost we pick at least a Sunday in a year that we do health sensitization, and I know many other churches too are also doing that. So I think with this one, I think the information will get to the nook and crannies, and I just hope that maybe we increase in our awareness, because I think many people are still not aware of this hepatitis B and how serious it is, that we should start taking precaution and even going for vaccination.
Again, I'll reiterate it. On well-being, we always say go for regular checkup. Do not assume that you are healthy just because you're not having headache or malaria, and do not think that malaria is the only thing that can affect you. Now, there is vaccination for hepatitis. I know that when we're much younger, that when we're babies, all these vaccines are being given to you free. But as you grow, because you're exposed to different people in the world, you have to intentionally still go as an adult. Yes, hepatitis vaccine should be administered after every 10 years. And I know that you looking at me right now, I'm just joking. When I'm a part of me just feels that you have not gone for that screening. I know someone is going to ask me, have you gone? Well, I've not gone, but then I'm going to go. So I'm encouraging all of us, let's go and check these vaccines, because you never can tell who your daughter will sit with in school, who you're going to sit with. You never can tell whether that your boyfriend that you want to go and see tonight might have hepatitis. I'm just joking. But I'm using this opportunity to say that all of us, we have to get vaccinated, because remember, number one, hepatitis A can be passed through contaminated food, and you never can tell whether your food vendor washes their hand properly. So this is why all of us, no assumptions, all of us, let's go for this vaccination so that we can be safe and sound. Thank you so much, Dr. Borg. I would not stop telling you thank you for bringing so much light on today's show. Now, to not my last question though, but what are the complications of hepatitis, and are there any superstitious belief regarding this ailment that you would like to debunk for us?
Okay, let me start with the superstitious belief. The Yes, it's a common thing in Africa that any disease that we are faced with, it may be attributed to one cause or the other, which may be spiritual or supernatural. But this one is like one advert that normally is done with HIV. Like said, it's a witchcraft that give me HIV. He said, no, no witchcraft. He went to one babalawo to go and find. He said, no, this one is not witchcraft. Go back and do your test. So hepatitis B is not a spiritual problem. When once you are being tested to be positive, don't live in denial. Just accept and do what you are told to do in the line of management, and you prevent all the complications, and you'll be able to live your normal life without any complications. So what are these complications? One of them is for that you have liver damage. And when liver is damaged, there are a lot of hormones and protein that are being produced by the liver. So if liver is damaged, that means you will not be able to perform these functions. So you will not be able to live a healthy life. That is why one of the symptoms is malaise, having that feeling of unwellness, the feel of unwellness and fatigue. So the liver damage will lead to cirrhosis. There is one condition we call liver cirrhosis. The liver begin to shrink in shape, and when it shrink in shape, it also reduce the capacity to perform the normal function. Then another one is this hepatocellular carcinoma. We call it liver cancer. So it can progress, and it is more with hepatitis B and hepatitis C, the untreated hepatitis B and hepatitis C that can lead to this condition. And if these conditions are not addressed in time, when it comes to the cancer, is like the end stage of the complications. So if your hepatitis is not treated, you did the test when nothing happened to you, you did not feel all those symptoms that I've mentioned earlier in this discussion, you just need to meet a doctor and get the appropriate treatment that will prevent you from having these complications. Because when these complications comes, it's difficult to manage, and when you have this complication, it can eventually lead to death. That means it may reduce your life expectancy. So those are the challenges. So you have the liver cirrhosis, you have the liver failure, which can lead to death, you have the liver cancer, and eventually death. So it's very important that when once you have done the screening and you are hepatitis positive, you seek for medical care. And this will help to prevent all these complications.
Thank you, Dr. Vog. That question was very intentional because we live in Africa where everything is witchcraft. I used to say that sometimes that witches were given a chance to talk. You could literally see all the witches coming out to say, this particular one, nah, it's not me. Now, hepatitis is not witchcraft sponsored. So please stop the whole story of I was sleeping, somebody, touched me and all. Go and see the doctor. If you notice these signs, please go to the doctor. Remember, hepatitis can be managed on time if it is detected on time. Now, Dr. Buck, let's come back to you. What is the difference between acute and chronic hepatitis? Because over the years, I've heard in my research, I saw acute and chronic hepatitis.
Yes, there is different. The acute is just immediate. One thing that the body has the capacity to clear some infection. Like I said, the hepatitis A and E, they only cause acute infection. If handled, the treatment is given, the body is healed, and the infection now confer them with immunity. They may not have another episode of hepatitis C even when they are in contact with it. So those one are the acute. The hepatitis B and C have both the acute and the chronic. When once the hepatitis B surface antigen persists in the blood beyond 6 months, we now call it chronic. So when once the antibody for hepatitis C persists in the body beyond 6 months, is now chronic. But within the first 6 months, the body handle it, you receive treatment, and it clears off. So that means you only had the acute hepatitis, which you have recovered. Another thing too, we also have carriers, especially for hepatitis B. Carriers, they don't have symptoms, but they can transmit the infection. So those are things that we need to also note.
Thank you, sir. Did you hear the part where he said that we have healthy carriers? Well, I said that earlier. We have healthy carriers of hepatitis. So in other words, you have to be very careful. I like the fact that he spent time telling women who go to fix their hair, go with your own, your own hair tools. Even to the men also, go to the barbing salon with your own, what they call that stuff? It just eluded my mind. Clipper, yeah. Go to the salon with your own clipper, your own nail cutter. To all those people who cut nails on their street, please, it's not too healthy for you. Except, your hairstylist or your manicure and pedicure, guy knows what to do, then we are all safe. But then it's also advisable that you have your own equipment that you can take care of. Thank you so much, Dr. Buck. But now let's talk about washing our hands after using the restroom, or to be very, very lay and basic, excreting. Now I know that you literally frowned your face or you're like, ew, but then is what I'm saying. Do you know that hepatitis A can easily spread from one person to another by putting something in your mouth, even though it may look clean, that has been contaminated with a stool of a person with hepatitis A? Now, let me give you an example. Let's say somebody went to the restroom and then came out and picked, maybe I was eating bread and the person joined me to eat that bread, and I happened to cut, to take a portion out of where, his hands was. And let's assume that he did not wash his hand properly. That is how you can have hepatitis A as a joke. Like, it is that simple and very funny. So I would like to encourage everybody, wash your hands properly. Don't say I went to pee, nothing touched my hand. No, wash it. You never can tell what you've picked from the toilet. And guess what? The last I checked, you cannot see germs. So please, and also I would like to encourage everybody, be with your hand sanitizers always, so that some germs that you cannot see, whether your hand looks clean or not, you can have a way of controlling it. Thank you so much, Dr. Ivok, for these insights that you've given today. But before I let you go, Dr. Ivok, what is your final words to those that have hepatitis and to those that do not have the disease?
What I want to say is that being positive of hepatitis is not a death sentence. Like, many people will even drop into depression just knowing that they are hepatitis positive. Some have even lost their partners, those their spouse, their fiancés, and they wanted to marry because they just find out that they are hepatitis B positive, hepatitis C positive. But being hepatitis B positive, hepatitis C positive is not a death sentence. It's something that can be managed and you can still live your normal life. So I'm now calling on the public that we should go for screening. Just know your status in respect to hepatitis B and hepatitis C, because those are the ones that cause chronic infection. The same way we also make effort to know our status, our HIV status, we should also use the same energy and also know our hepatitis B, hepatitis C status. It will help us be able to know what to do and to help us to live a healthy living. Because if you are positive, you go for the treatment and you get better. And if you are negative, you know how you can intensify on your preventive measures. And it will go a long way to help us reduce the new transmissions in terms of hepatitis B and hepatitis C.
And that's all we have for you on Wellbeing today. Once again, for the upteenth time, thank you so much, Dr. Ivok. Imagine how much you could have paid to get this information, but here we are bringing it to you in a platter of gold. My name is Emedion James, and it's been awesome anchoring this show. Remember, this is your show. So if you have any topic you want us to talk about, kindly send your questions or contributions to our social media page at Spectrum TV on Instagram, Facebook, and subscribe to our YouTube channel, all of which you can find on our website at spectrumtvlive.ng. A phone number will be displayed on the screen for people that don't have patience to go through social media. Just reach out to this phone number, drop all your questions and contributions, and we will get back to you. I am Emedion James, and this is Wellbeing on Spectrum Television. Do have a lovely day, and remember, your health is wealth. Bye for now.